All right. Time for some pre-cals. What's going on today?
Oh, hey, Jerry. We have got Dr. Amy Bender. She is joining us from the the diagnostic manufacturer, Cerebra. They've
Okay.
got a lot of neat things going on at that company. Matter of fact, I think they just have got some new partnerships, some new things that have put them in a new position that people can find out when they go to their website. But no, it's a new technology, level 2, I believe, technology that our listeners, I think, could be interested in. It's coming. It's new to the United States, but it'll be exciting to hear what Dr. Bender has to say about it today.
Is she a sleep doc?
She has a PhD. We'll hear a little bit about that in our intro, but she has a strong background in sleep, going back to being a sleep tech of all things.
Wow. Okay, that's impressive.
All right, so I have to confess, I'm a little upset because this is my second place sleep medicine disruptor change agent plaque that I got from the American Academy of Sleep Medicine, and it was to Dr. Bender that we finished second. So,
oh man,
yeah, so I'm a little
brutal.
I'm a little sideways about this whole conversation today.
Okay. Well, try to be nice. Try to play nice. Okay.
I will.
Yeah.
I will.
Okay. Well, with that note, let's move on to the show.
All right, folks, a quick message before we get started from our sponsors, React Health. React Health, formerly 3B Medical, a leading provider of sleep diagnostic, and respiratory products. Now back to the show.
Lights out.
Welcome, everyone. It's another terrific day here in the land of Sleep Tech Talk, the sleep podcast. And we have another terrific guest. But before we get started, just want to tell everybody, thank you all so much for joining us. It's been fantastic having you all on this journey since we started last year. Don't forget to keep liking, hitting the like button. Don't forget to subscribe. And most importantly, do not forget to share this with your friends, all the fellow techs that are out there. And share the podcast. Let them. We're out there for them. But keep the show moving. Emerson, who do we have on the show today?
Well, thanks, Jerry. We are really blessed to have Dr. Amy Bender with us. She is an award-winning sleep scientist, the director of clinical sleep science at Cerebra, and adjunct assistant professor of kinesiology at the University of Calgary. She started off in the sleep field as a sleep technologist, working in a sleep deprivation research laboratory, and received her PhD and Master of Science degrees in experimental psychology from Washington State University, specializing in sleep EEG. Her current interests focus on how to help people sleep better by improving sleep disorder treatments with more precise digital sleep metrics. Just a quick summary of Cerebra. Cerebra Medical Limited is a Canadian technology company transforming the future of sleep diagnosis and therapy. Cerebra unites innovators and researchers with a common goal and passion of putting sleep back in sleep medicine. The Cerebra Sleep System is a U.S. FDA authorized Class 2 medical device. Cerebra uses the patented algorithm odds ratio product, ORP, that microanalyzes the electroencephalograph EEG signal, providing a continuous measure of sleep depth, moving beyond conventional scoring methods to dig deeper into brain activity. So for more information, everyone can look at cerebra.health for more information. So Dr. Bender, what a great backstory about you. We're excited to talk to you about the odds ratio product with Cerebra. But before we do, one of the things we certainly enjoy and our listeners certainly enjoy is how you got here, because for the three of us, we didn't plan on this. We just sort of ended up in sleep and fell backwards into it and fell in love. How did you get into sleep technology?
Same kind of story for me as well. I was kind of looking into a new career And my aunt was a sleep technologist at the time. And she said, "Hey, why don't you come over to my sleep lab and I'll show you what I do?" And so I went over there. She showed me, she hooked up a patient, showed me the translation onto the screen, what those physiological signals looked like. She showed me the different stages of sleep and how she scores sleep in those different respiratory events, and was pretty much hooked after that. So back then, that was around 2005, 2006 or so, where you could do on-the-job training to become a sleep tech. So I literally called every single sleep lab that I could at Spokane, where I was living at the time, and asked if I could volunteer. And one sleep lab kind of took me up on the offer. I was able to observe an overnight study, and then just luckily kind of landed a job as the sleep tech at a sleep deprivation laboratory at Washington State University. They were looking for a sleep technologist, and actually the person I was volunteering for was on the hiring committee of the director of that sleep lab. And so they reached out and said, "Hey, do you know any sleep techs?" And I ended up just serendipitously landing a job with them, and was really interesting being in a sleep deprivation lab as well, where we would sleep deprive participants for up to 62 hours. So it was a great start into the sleep field, and kind of at the same time. So the requirements for our PSGT is that a lot of your work is clinical. So at the same time that I was working at the sleep deprivation lab, training research assistants on how to hook up patients, scoring sleep studies, I was also doing a bit of night work at a clinical lab as well, a sleep disorder center lab, 2-3 times a month. So that was interesting to have the research experience and then also the clinical experience. And then I was like, I need to get my master's and PhD. I want to really explore what we can do with sleep research. I was really interested in it. Ended up getting my master's and PhD, and then landed a postdoc at the University of Calgary, where I was working with Canadian Olympic athletes and helping them optimize their sleep. And then really had a job as a senior research scientist in charge of the research department at a counseling center, but there wasn't a lot of sleep with that type of work. And so I was really excited when the job opportunity came up at Cerebra, where I was able to, lead the research department as director of clinical sleep science and combine my passion for sleep, get back into sleep full time. And really excited the work that we're doing there right now.
So that's quite a journey. You go from sleep deprivation to sleep optimization to research. How did you make that leap? Because that's quite a mental journey to go from keeping people awake to helping them sleep, and then to the diagnostic world that you're in now. That's quite a journey.
That is interesting. I guess if you think of it that way, with the sleep deprivation research, it was primarily normal, healthy sleepers, and we're seeing what is the impact of sleep deprivation on cognition, and how does that relate to EEG changes as well. So that was fascinating. So not a sleep disordered population whatsoever with that type of work that I was doing. And then with the athletes, it was more exactly like, how can we optimize sleep for performance? And, just trying to gain any edge that they can in order to boost their performance. So definitely a different group there. And then now working towards how do we better diagnose and treat sleep disorders? How do we get patients the help that they need? How can we provide more information with metrics like the odds ratio product to really influence the way we treat and help manage patients as they work through their sleep disorders?
So speaking of the odds ratio product, that seems really complicated, and for our listeners, how can you break that down for us? Because that, your journey's taken you to this place of diagnosis and being able to use that type of algorithm to test patients. Can you kind of give us a journey through that? How did Cerebra get there, and what does that technology look like?
And break it down, not just for the listeners, for us hosts as well. We're not that smart. So,
Yeah, we just look smart, but yeah.
Yeah, no problem. So our scientific founder at Cerebra, Dr. Magdi Yunus, he developed the Cerebra sleep system, or the technology to assess sleep in the home with our hardware, so the patient can self-apply our technology in the home. So that's our hardware part of our technology at Cerebra. But with that, we also have the odds ratio product, or ORP, which micro analyzes sleep using the EEG. So it's breaking down the various frequencies, so delta, theta, alpha, beta, and it's looking at kind of the amplitude within those powers in 3-second increments. So it's looking at these different combinations of frequencies, the amplitude or the power within those 3-second bends. And ultimately, it's kind of a probability: is this person awake or is this person asleep? And so the overall scale, it's a sleep depth scale of 0 to 2.5. And lower numbers indicate more of those deeper states of sleep, whereas higher numbers indicate full wakefulness. So there's many different ways that we can dice ORP. So that's kind of the overall way that we get ORP. But we're able to look at ORP in non-REM sleep and REM sleep across the total recording time. We're also able to look at it during wake as well. So we're seeing with insomnia patients, they have higher levels of ORP, so full wakefulness, during that total recording time. And also able to look at it even 9 seconds post arousal. So there's many different ways. We're looking at the depth of sleep in the 9 seconds post arousal, and it's just a really high resolution way. And that provides us a lot more information than if we were just looking at, for example, percentage of sleep stages or even the arousal index.
Amy, I love this because this is a little bit of old school sleep technology, but it's certainly new and the future of what we're doing here in the world of sleep. Sleep. Um, can you tell us a little bit about the different types of, like, I know with the Cerebra product, it offers different levels of testing, and even up to full PSG in the home, I think is part of that system. Can you talk about that a little bit? Because that's certainly a transition, of where the patient can be diagnosed.
Absolutely. I mean, that we want to put the sleep back in sleep medicine. So having that EEG element is important, but we want to do that in the naturalistic environment, because we know that you sleep differently when you're in the sleep laboratory versus when you're at home. Of course, having all those wires has something to do with that, but the environment matters. And I think we've kind of overlooked that when it comes to all of the research. So our device has the capability to measure sleep in the home in a self-applied fashion. So the patient is able to self-apply the product, because we're looking at frontal EEG activity. So it's on the forehead. There's nothing, in the hairline or anything along those lines. And so they're able to self-apply it with flexibility of configuration as well. So we're able to do level 3, level 2 with legs, ECG, the full meal deal. So different ways to have that configuration with different patients depending on your needs. And then, yeah, the product, like, the patient looks at the videos to help them self-apply the device. And then one of the other key features is that you're able to, as a clinician or a sleep technologist, you're able to, as soon as that patient ends the study in the morning, gets auto scored with my auto scoring. And so you're able to kind of see those results within 5 minutes of the study ending. So you're able to see the success rate of that study, if the cannula might have fallen out or anything like that, so that the patient can redo the study if they need to. And we are finding really good success rates as well. Around 85% of our studies are successful after that first night. So despite having more channels, electrodes, we're still seeing similar success rates to what you would see with a level 3 study.
So from a live monitoring capability, I guess that's not in play today. It is recorded locally and then I guess transmitted after the study takes place, which is still great technology. Is that something that's on the roadmap in the future to potentially have some type of ability to, view the patient while they're undergoing the test?
It is on our roadmap. We don't have kind of a timeline as to when that will occur, but even I had a meeting the other day with someone who was really interested in that live monitoring capability, and they were doing like palliative surgeries for sleep apnea, and they were really curious. Does sleep depth change depending on the level of anesthesia and things like that? Unfortunately, we don't have that kind of in the product right now. It is on our roadmap, but no real timeline as to when we could get that.
So, Doc, this is kind of deviating from our current discussion, but if I'm a registered sleep technologist today, what kind of pathway would I take to get to where you are right now?
Yes, I loved being a sleep technologist at the time. It was great. I was really interested in that research, and having started kind of at the sleep research lab, that's where I really became interested in research and wanted to, get my master's, get my PhD in sleep science. And so I think the sky's the limit. I started graduate school when I was in my 30s too. So, you're never too old to start something new. And so I would say looking into a program that has sleep, which there's a lot of programs throughout the country, that there's a lot of sleep research labs that focus on different areas of sleep. So trying to figure out your interest area would probably be maybe the first starting point. And then seeking out labs where you could potentially start your graduate work is a way to kind of get to where I am, I guess.
Kind of building on that a little bit, Dr. Bender, when you think about where you were as a tech and where you are now as a researcher with a manufacturer, that's a light year apart in a lot of ways, from thought processes to, well, just everything. But how, when you look back and you draw off of those experiences as a sleep tech, how does that help you now as a researcher when you're, drilling down into the process pretty much end to end? How do those early years complement what you're doing now?
Very, very good question. I feel like I use those experiences on even a daily basis potentially, and I'm trying to think of a good example. Just as it relates to the different metrics, so understanding the different, sleep stages and how can we look at EEG metrics in a more effective manner. So having that baseline knowledge is really helpful to, see how we can utilize some of these novel metrics, and keeping the patient in mind too, having that experience with the patient and really thinking about the problems that they're suffering from and how can we better treat and better manage these disorders, I think is really important to keep that in mind and those experiences in mind, which I had when I was working in the clinical sleep disorders lab. And yeah, even even just seeing some of, I had a call today with a sleep medicine physician, and she was talking about alpha intrusion and how she's seeing a lot of patients with alpha intrusion and what can we do in that scenario. So having that background, I think, can really help, and having that experience can really help keep in mind the patient and how can we better treat and manage these sleep disorders.
So
Which
with that,
you wouldn't,
no, go ahead.
you wouldn't necessarily get if you're just a researcher focusing on a certain, research area.
No, absolutely. And it's kind of where I was thinking now is thinking of our audience and how Cerebra and the technology you have for the sleep lab manager that's listening right now, or the sleep tech that is wondering how this Cerebra and the and ORP fit in their world. How would this fit right now if they're thinking, is this a solution for me? How would they apply your technology to their world?
Very good question. I think, one of the things we're working on right now is, can we use ORP along with other respiratory metrics to predict who might do well on CPAP or not? So our scientific founder published a paper on this recently, and we're in the very beginning stages, but we're interested to know, who will be adherent in the future, and how does sleep improvement on CPAP relate to that? So ultimately, from our standpoint, can we identify a patient who may not be predicted to do well on CPAP, but they still need it for cardiovascular risk, they still need it for, hypoxemia, et cetera. So can we even change the conversation with these patients? Like, hey, it looks like we may not see a huge improvement in your sleep, but this is really important for your overall cardiovascular health. We're looking at kind of problems like that we want to solve. And I think, a sleep tech working with patients as well, that kind of information would be useful to just have more higher resolution information to be able to influence kind of the treatment plan.
Well, Robert.
I know you were. I wasn't quick enough to get to my unmute button before you got to yours, Jerry. Just one more question, just so you can tell the story of Cerebra and how you've helped to catch up the backlog of patients. I saw an article on that, I think, if that's right, and maybe you can give us just a quick rundown on what that looks like, and then I guess we're going to close because Jerry always does that to us.
Yeah, no, we're really excited. In Manitoba, the province of Manitoba, we have a huge backlog for patients who are needing to have a sleep diagnostic test. There's one main sleep lab in all of Manitoba. And so all patients, need to be kind of funneled through this main sleep lab. And so the government of Manitoba put out a proposal for people, like, how can we take care of this backlog? And so we're really excited to get to be able to utilize our technology to reduce the backlog of all of these patients in a scalable way. So you don't need necessarily a sleep lab bed, can be done in the comfort of the patient's home. So we're really excited to help people get their sleep diagnostic test in a quick manner, help reduce this backlog. And then the research opportunity is huge for us as well, to be able to study some of these patients and how their sleep changes along the treatment pathway is really important for us and exciting for us.
Well, thank you, Amy. Now I hit the unmute button, and I promise you, it's not because twice you said Emerson's questions were really good ones. I'm not jealous of that, but we are truly out of time. And thank you so much for joining us. Is there anything that you want to tell the audience before we close?
I think, well, first of all, thank you for having me. And knowing your audience, I think I want to go back to the sky's the limit for you. So if you're really interested in trying to make new discoveries in sleep, don't feel intimidated by going to graduate school, getting your master's, getting your PhD. So I guess I'll leave the audience with that.
Well, thank you, Dr. Amy Bender. We sincerely appreciate you joining us, and it was definitely our pleasure to have you on board with us over here. And for all our audience, take that little nugget with you. The sky is the limit. And remember, there's no limit to how many times you can share this podcast with your friends. So please don't hesitate to do that. Don't forget to do that. Smash the like button. Hit the subscribe. Until next time, we say thank you. And on. All right, that was quite a show. Let's have some post cows. What do you guys think?
She definitely delivered on her journey. I think that was one of the things that was great to hear about for our listeners who are wondering where their career can go. I mean, she's taken it all the way to the end, and now is literally helping change the face of sleep medicine with the technology have. So very, very fascinating story and product. I was glad we got to hear about that today.
I will say, changing the face of sleep medicine, if these three faces are the faces of sleep medicine, they really need to be changed. Don't you agree?
Yeah, it's people can't unsee this.
That's yeah. So those of you who are not on YouTube and listening on podcast, just be very grateful. Okay.
I hear you.
Hey, by the way, I didn't even bring up the whole finishing second place to her in the change agent contest for the ASM last year.
That's very nice of you.
I'm upset about it, but I didn't want to ruin the moment. She did a great job on the show today, and you know what? I hope that what it does is encourages people to see, not necessarily a pathway, off the night shift, but a pathway to, something that can change the course of how patients are diagnosed with sleep apnea ultimately, and to move from the world of being a sleep tech into research and now working for a manufacturer. The thing that encourages me too is that there's some really smart people who are involved in developing these technologies.
It's interesting you said that. I was going to crack another joke, but let's stay on track here. Interesting you said that about the research, because we've had a few researchers on our show, and they keep talking about that specific pathway and where it took them, either developing programs for a facility or a university, or developing new products like here, for example. So I think that's something that's really, really overlooked in the industry as a whole is the value. Shucks, we had somebody on here. We had a guest on here that now works for Amazon, because they're currently doing research for Amazon in the sleep field. So who knows? You never know where it's going to take you.
Well, I think too is how diagnostics is changing. When three of us started, it was a pretty linear situation. You hooked them up, you had a polysomnograph, you ran it, it was ink everywhere. And then now we're at this place where you can diagnose from their finger, from their chin, from their scalp. There's so many different ways. And I think that's what's so fascinating right now is these researchers are looking at so many different opportunities to help us better diagnose patients with sleep disorders and waking disorders, for that matter, to her point. So I think that's what's the fun part of what we get to do on our show is get to hear innovation. We're talking to the pioneers who are really taking us to that next place in sleep medicine, and what Cerebra and Dr. Bender are doing is absolutely in that space.
I think that's the new theme of our show. We seem to be the launch pad for these companies. If they're going to make it in this industry, they got to start here.
That's right. That's right.
Hey, start with SleepTech Talk. That's the way.
That's right.
Well, I think that's a great point for us to close. Just want to say thanks to everybody out there. We sincerely appreciate you guys listening to us, to all you folks listening to us. Keep sharing the word, keep spreading the good news about SleepTech Talk. We're continuing to grow, and we thank you so much for that. And until next time, cheers.